Welcome back. Let's get right back to state epidemiologist Dr. Benjamin Chan, who joins us tonight to answer your questions live on air. Michael asks, my wife and I got our second boosters in April. An upcoming trip will expose us to many more people from everywhere. We will wear masks, but should we do anything else? He says we are both over 65, with one of us a diabetic.
Yeah, so I would say that it sounds like you're doing or taking the appropriate steps to protect yourself by getting those second boosters, by considering wearing masks when you're in higher risk settings. The only other couple of things I would add is that indoor crowded places where lots of people are gathered continue to be higher risk settings for spreading and transmitting COVID-19. And so anything you can do to limit, indoor crowds would be of benefit to you if you're concerned about your individual risk for COVID-19, trying to conduct activities outdoors. And then if you do end up having symptoms, particularly after travel, make sure you get tested. And again, as I mentioned earlier, the at-home or self-antigen tests, sometimes it can take a couple of tests for an infection to be registered as positive. But if there's concern for infection, take a couple of antigen tests or go and get a PCR test so that infection can be identified early. Because if you do develop infection, there are medications available like Paxlovid that you should be reaching out to your primary care provider about to see if you can get put on those to prevent progression of more severe disease.
All right, our next question is from Lisa, asking if we had our second booster in April 2022, are we still protected from severe disease? Is it a fact that the booster wanes to no protection after 8 weeks?
Yeah, it's a great question. So we know that vaccination, particularly the primary series plus the booster, offers longer-term protection against severe disease than it does against preventing infection, right? So we know that, within a few months after getting vaccinated, protection against infection starts to decrease. But we know and we expect that protection against severe disease will last much longer, on the order of months, if not years. But the exact duration of protection against that severe disease, at preventing hospitalization, preventing deaths, still is a little bit of an unknown. But we do expect that the primary series plus the booster is going to offer much longer term protection against severe disease. And so I would expect you to still be protected against severe disease. But again, there is a role for taking additional precautions, particularly if you're at higher risk for acquiring COVID or a higher risk for developing severe disease, as we just talked about.
Now, this viewer is asking, I tested positive for COVID this year on June 3rd. How long do I need to wait until I can get a booster?
Yeah, it's an excellent question. So vaccine can be given as long as somebody is off isolation, right? Meaning they're no longer considered infectious to other people. CDC does say in their clinical guidance that after an infection, people can consider waiting about 3 months or so before getting vaccinated, because the risk of reinfection during that time period is considered low. But somebody can go in and get vaccinated with a booster at any time after they're off isolation and no longer infectious to other people. But there's this window where people could consider delaying vaccination for at least 3 months. And I will add on to that, though, that even people that are infected should still get vaccinated and should still get boosted. It's been shown very clearly now that protection and immunity from both natural infection combined with vaccination produces what we call superior hybrid immunity, higher levels and longer lasting protection.
All right, Dr. Chan, thanks so much for joining us. That was our last question.
Great, thank you.